and welcome to the NGO Whisperer Show. My name is Dr. Carolyne Opinde. I'm the founder and CEO of the NGO Whisperer Center for Social Impact based in Manchester, United Kingdom. Here at the NGO Whisperer Center for Social Impact, we work with non-governmental organizations, social enterprises, governments, and funding agencies to promote social innovation and investment for a sustainable world now and in the future. In Season 6 and Season 7 of the NGO Whisperer Show, we focus on our Global Fellows, Class of 2022. Joining us today from Johannesburg, South Africa is Tumi Mabitsela. She is the founder of Mpilo Mobile Health. Tumi is one of our Global Fellows, Class of 2022. Tumi, welcome to the show.
Hi, Caroline, and thank you very much for having me on the show.
Tumi, it's such a great honor and a pleasure to have you. As we start this episode, share with us what inspired you to step into the nonprofit sector. I know you have worked in corporate South Africa. You have a law degree. What inspired a lawyer to get into mobile health?
Basically, Caroline, it was a time in 2013 when I left corporate and into formal employment that I had a very unkind experience of experiencing being part of the recipients of public health care. And that inspired me to stand up and do something and not only complain about it. Having been previously exposed to the healthcare sector and fortunately linked to the NGO space, I had some knowledge of purpose work, and I had to then come up with creative ways to have Mpilo Mobile that would be able to bridge the gap in access. So from waiting in those long queues, I was inspired as an ordinary citizen to say, how can I assist and lessen the burden on our public healthcare infrastructure?
Share with us what's the focus of Mpilo Mobile Health. Where do you operate? I know you are mobile, but at the same time, there are areas that you focus on providing your services. And who are the partners that are making it possible for you to provide this much needed access to primary health care?
Our key focus is actually bringing comprehensive quality healthcare services to people via mobile pop-up clinics. And when we refer to mobile, we don't only refer to a vehicle, but having the mobility to go to where the people are. So we focus on urban, semi-urban, and rural communities that are underserved. And we partner with both private sector and government through purpose-driven impact solutions to then bring these services to the communities that are underserved.
Where have you implemented your work so far in South Africa, and who are the primary beneficiaries of your services?
We have done our work throughout our 9 different provinces in South Africa, and naming the Gauteng, Limpopo, KZN, Northwest, etc. And the primary beneficiaries are the communities who are not on medical aid. As you would know, about 97% of South Africans depend on public health care.
It's amazing. The work that you're doing is providing the much needed access to primary healthcare and contributing to universal healthcare access in South Africa. And South Africa is one of the countries in Africa that has very good healthcare system, but still there's a need to strengthen the healthcare system. Who are the partners who are supporting this important work?
One of our key partners, if I would name but one, is Reckitt Benckiser, which is the pharmaceutical company that manufactures Dettol, the antibacterial soap. Through a purpose-driven marketing program that we have with them on education of hand hygiene and the importance of practice of hand hygiene to prevent disease, they have co-funded our work that we do in the provision of not only education and awareness, but actually providing the services to the people in the primary healthcare sector.
Do you hire doctors and nurses to work for Mpilo Mobile Health? How does that work?
We do have medical practitioners, doctors, nurses, dietitians, clinicians, and also ordinary citizens whom we train to be healthcare data capturers. So we would normally advertise within the communities that we work in, because it is very important that even our staff have easy access to the community. So in the areas that we work in, we would get our doctors, our nurses, and including our general support for the clinics from that community. And we would use local platforms to share the opportunities that we have for people to work with us.
Does your work also include working with an app, or this is only mobile pop-up clinics?
We are a technology-enabled enterprise. So we do have a technology platform where we have a healthcare app that can be accessed by not only the beneficiaries, but other key stakeholders. As you would know, primary healthcare is the first level of entry into the healthcare system. And sometimes patients might need to be referred to other institutions. And we use the app to actually record healthcare data. So what you would have had recorded in a doctor's file or hospital file is what we would record in the app. And both beneficiary and anybody else who has rights and roles of, including funders, has got access to our.
Thank you so much for the amazing work that you are doing. So far, what's the impact of your reach? How many people have you reached with these important services?
We have actually reached over 5 million beneficiaries through the work that we do, and we are quite excited to have been able to touch so many lives. And over 16 million education and awareness. That is where we were just able to educate the community on how to better look after themselves.
I'm sure with more funding and support, you'll be able to reach even more, because there are more people who need access to this. As you said, 97% of South Africans depend on public healthcare system for their primary healthcare, as well as other referral specialists that they may need. Now, thank you for joining us at the NGO Whisperer Global Fellowship Program. We're just so honored to have you and your expertise as one of our global fellows. What inspired you to join us, to apply and be one of our global fellows in 2022?
Caroline, I think the NGO Whisperer does phenomenal work. Having heard testimonials of other previous fellows, having looked at some of the work that the NGO Whisperers has done and publications written, and the support that it gives to social entrepreneurs, it was actually a dream come true. So I was one of the last candidates to be accepted into the program, begging to be accepted into this phenomenal program. So I honestly wanted to jump on the bandwagon to learn and to be part of such a movement which is unique in its nature, because there isn't much support where you find other community of social enterprises and entrepreneurs collectively in one place and on a platform to learn and share knowledge.
Thank you. We are honored to have you. Tumi, you have engaged in so much capacity building training that you have received from various universities in South Africa and internationally. From the Global Fellowship Program, we would like to know, what are your top 3 new areas of learning or knowledge or insights that you would like to share with us today?
One is definitely monitoring and evaluation. The importance of monitoring the work that we do and constantly evaluate it, and being able to report to your stakeholders. Secondly, I have learned phenomenal ways and gained insight on how to write grant proposals. It is very technical in its nature, and it's not that easy. It is beyond the narrative of the work that you do. How do you communicate with the people that you want to give you funding in the manner that they're able to receive the information, get what your outcomes, your inputs, your outputs are, and be able to draft a budget? And lastly is just managing change. I've learned the importance of change management, not only internally in an organization, but managing it to include your stakeholders as well, and how the importance of inclusivity actually has a significant bearing on the movement of the organization and getting it to grow.
Thank you for sharing that. How has your organization changed? How has Mpilo Mobile Health advanced or grown as a result of your participation at our Global Fellowship Program?
I must tell you, Caroline, the one way that I wanted to measure the growth of my business, and I did say how I want this program to impact, is that I must be able to at least use what I've learned to gain one new client. And I'm happy to tell you that I've been able to secure a new partnership with a client in a different space. And all of that came from learning how to actually put together a logic framework, submit it, follow the steps in how to engage a new client, how to pitch my program to this anticipated client, and work all the way to actually closing the deal with them. And all of that process, as a process I began in October, and I was already on the program, and I used every little thing that I learned from the program. So how I've changed is that we've increased revenue, we've increased the number of beneficiaries that we now have.
That is fantastic news to me. What plans do you have for 2023 moving forward from Mpilo Mobile Health?
2023 is our year of growth, of diversifying and expanding. With all the avenues that were shared with us in terms of how to access funding, this is really going to be a year of multiple grant proposal submissions for Mpilo Mobile, and being able to secure those. That is the one thing that we want to focus on, and not be involved in too many things that will confuse us, is that the business is at its growth phase. We want to expand, we want to scale up. And the only way we can do that and increase the number of beneficiaries is in securing more funding. So we really are on an intense funding drive, and using all the platforms and websites that have been shared to us to find opportunities to access grants, further partnerships, and funding.
We're excited for what the future lies ahead for Mpilo Mobile Health. What about you as a leader?
As an individual, I am pursuing my studies in public healthcare management, because it is an integral part of our business. And working within the public healthcare infrastructure, I think it is very, very important for myself as the leader to gain an even better understanding of how to serve our communities, because you do know that, Caroline, we cannot run a parallel process that competes with our government, but only to complement what public healthcare is already doing. So as a leader, it's to gain more knowledge in the public healthcare sector and management thereof, and prepare ourselves for the national health insurance that will hopefully be kicking in towards the end of this year.
Congratulations on everything that you have set for 2023, and we are here to walk the journey with you as one of our VIP clients as well. So we are excited for what Mpilo Mobile Health is doing in South Africa, providing complementary primary healthcare services to those who need it most. As we come to the end of this show, share with us, what is your message to the government of South Africa, the Department of Health, as well as good citizens and other civil society organizations, whether they are social enterprises or non-governmental organizations, on promoting access or providing access to primary health care to those who need it most?
I would say that it is collaboration, both to our government, our fellow social entrepreneurs and social enterprises. Let's be open to cross collaborations. We are not competing. We all want to achieve the same results. Let's stretch, even if we are in the same space. There is a lot for us to leverage on each other's expertise and our strengths to further better the provision of healthcare services in the country. So it goes both to our officials and government to say, open the door. We are there. We want to help you. How do we partner to bridge the gap in access to quality healthcare?
Absolutely amazing. Thank you. Where can people find you? How can they connect with you?
We can be found on www.mpilomobile.co.za. We can be found on our Instagram handle, Mpilo Mobile. We are on LinkedIn as well under Mpilo Mobile. So please do go out there, connect with us. We'd love to work with you.
Thank you so much for joining us. Thank you for being one of our global fellows. We wish you the very best, and we look forward to walking this journey with you and making a greater impact in South Africa. Thank you, Tumi.
Thank you so much, Caroline, and thank you to NGO Whisperer. You really are giving us wings.
We appreciate you. Ladies and gentlemen, thank you for joining us today for this episode. We invite you to subscribe to our YouTube channel and follow us on social media. For those who are keen to also participate in our weekly masterclasses, we offer 2-hour masterclasses that are free at the end of every month. And at the same time, we offer 4-week high-impact masterclasses. To be part of it, go to ngowhisperer.com/masterclass. Join us. Bring your people, bring your team. Let's help you build their capacity so that they can effectively impact people's lives. Thank you so much. As always, it's all about connecting people, raising funds, and impacting lives globally.